Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine for the individual, society, and the world. And today I am going to, sometimes I talk and sometimes I ask questions and listen, and that's what I'm going to do today in an interview. And the title today is Assessing Your House or Business for Mold. Is there a right way? And this is an interview with James Weber, specializing in another important keywords, medically important assessment and remediation. So welcome, James. Thanks for coming on the show today.
Yeah, thanks for having me.
So this is a topic, I'll tell you how I got started in mold. I didn't want to get into mold, and I went to an Alzheimer's conference about 2016, and Dale Bredesen, who he was at the conference that you were at just recently, spoke on Alzheimer's, and then there was a certain group of patients that wouldn't get well, and he had two or three physicians come up and speak about this thing called CIRS and chronic inflammatory response syndrome. And anyway, it wasn't until they cleaned their house out for mold and such that was a significant part of their medical therapy to help with their cognitive improvement. And so that sent me on a journey of something I didn't really want to do, was get into mold, to looking at it. So the biggest difficulty, truthfully, I just had it happen to me today, is how do you assess the place initially? Because that's where people get stuck. They talk to their neighbor who's a contractor, they talk to their son who's a contractor, they'll do whatever, and you know the story. And then I try and do it a particular way to get particular results, and then sometimes it flames out because people get frustrated, and it's very expensive too. So, James, introduce yourself, please, and tell me what you do for a living.
Okay, I'm James Weber. I own JW Environmental. We specialize in medically important remediation, assessment, and remediation. I've been in the industry for 23 years and just specializing in mold. Just as I've developed in the industry, my specialty has just narrowed down to medically important remediation. So that's all that I do, is just medically important assessment and medically important remediation for people that are sensitized to mold or diagnosed with mold illness.
So, how did you? Were you a contractor beforehand? Or you just learned the business being around people? What is your?
I was in the industry. I started out in carpet cleaning. So my family had a carpet cleaning company back in the 90s. I was cleaning carpets. And then that was when basically everybody had carpet. Carpet was the most popular flooring. So when people had floods, a toilet overflowed or roof leaked, their carpet would be wet. So they would call the carpet cleaner to come and suck out the water. And from that, the industry kind of developed into water damage restoration. We realized that sucking out the water from the carpet wasn't enough, that there were wet walls and wet floors and things like that needed to be dried. And then sometimes we would find damages that led to mold, because it had been leaking for longer than a few days. And sometimes there was mold. So that developed into mold remediation. And then that's how I started doing mold remediation as a specialty from there. And then just dialed in.
So you have some keywords that most people don't put in their bios or their advertisement. Medically important assessment, number one, and then medically important remediation, which are obviously, I feel very strongly about. So how do you, let's see, why did you get into that part, the medical part first?
So it was just a development of my skills, basically. When I started doing mold in 2002, specifically, specializing in mold remediation, that was when mold became kind of a big deal in the industry. That's when farmers started having their big mold lawsuits. That's when Ed McMahon had his issue at his home, and black mold and that that kind of stigma, it just kind of started taking off. And so the company that I was working for was one of the pioneers in getting into mold remediation. And so I think it was a sweet spot to get in terms of timing, because the industry was developing. So we got to see the development of different processes and procedures. And I think we just had our strategy was just quality over everything. So we just wanted to do it, the right way, the best equipment, the best practices, do what works. And from there, we got aligned with John Banta, who's one of the pioneers in the industry. And we worked a lot with him and his team. And that's how we just got a reputation for just doing really quality work. And so that came along with, that got into, who can do remediation the best, right? Because that's what medically important remediation needs is what are the highest standards? What are the best practices? Who does it by the book? And so it was because we were focusing on quality that got us into that kind of medically important field. It wasn't just, how can we make the most money or how can we service the most people? It was how can we do the best job?
So John Bant, I'm very well aware of. I think he came by our clinic maybe 25 years ago. I've used restoration consultants before. But I have a question. So you were mold remediation. That means fix the problem. But then somehow you evolved over to assessment of mold. And so some people think there's a conflict of interest. You don't have the person that says, hey, you got mold in your house, and then, oh, that's the person that fixes it. Now,
Sure.
I understand from your point of view, if you're good at both, please do it. But how did you start doing, or why did you start doing mold assessment?
Sure. So it was really out of necessity. Basically, I was a remediation contractor for a number of years. So, from 2002 to say 2016, 2017, 2018, that's when I started really noticing the things that were getting missed by the traditional inspectors. A lot of times we would just get referred to a project that they had done some testing and said, we have mold in our house, but we don't really know where it is. And sometimes it was obvious enough that an inspector had been there and they pointed to, a leak in a kitchen or people that had had some previous water damage in their bathroom. So they focused on those areas of known damages, which is a great first step. But in doing that, they were missing other things that were hidden in the home. And so, I think there was a combination of doing work for clients and then getting calls back, a year or two later that said, hey, remember you did that big remediation for me in my kitchen. And, we hoped we were done with mold, but it turns out we went back to the doctor or we did some testing and I still have mold in my house, so I need you to come back. And, it was that kind of repeated cycle that got me to strategize on what can we do better to stop people from continuing to have mold every 2 or 3 years and, go through this process and think that they're fine and then realize they have another mold condition in their home. Basically they were missing it. And so out of that, a basic visual inspection and identify where the mold is. You have to spend a few hours on the project. You have to be a little bit aggressive. You have to do different kinds of testing methodologies that a lot of other inspectors aren't doing. And so that just led me to doing medically important assessment.
So, you're very well of the CIRS, chronic inflammatory response syndrome in the group. And one of the most difficult things as a practitioner, especially if you follow strictly the guidelines, is the person has to be out of the environment before you try and detoxify them or pull the mold out, so to speak. And that is the most difficult point because it's somebody's home or they're renting or whatever. And it's the challenge for me because what a patient will do will say, listen, I'm not going to go spend the money to do X, Y, and Z. Just treat me, which is counterproductive, so to speak, or it's not efficient. So one is I tell people, and just because I've gone to some CIRS things, and I want you to tell me because I know you do assessment, you have a fee for assessment, and then you would have add-on tests if you think it, whatever's important. And just give me your 2 cents. So I was kind of raised with the ERMI test way back when, um, and then I, started to do ERMI and actinomyces and endotoxin on one panel. And then if that's high, because they give low, medium, and a high risk, then I call in the John Bantas or you people and say, okay, now find out where it is. And I tell people that mold is like cigarette smoke; it goes up in the air, dead or alive, and it lands in places, and it's a total load. So I have one question for you, and not one, but it's that um, is it better for me as a practitioner to just say, call you up and say, you go assess the house, or now the problem is the person, well, or do $560 a panel number 8 that does those 3 tests I told you about: endotoxin, mycotoxin, excuse me, endotoxins, actinomyces, and an ERMI test. Because, all right, so the person's out $565. It's a screen. And I've done, I'm pretty sure that I've done the blood parameters for CIRS. So I know that might be a tough question and it might not be their perfect answer, but I want to I want to spend as least amount of money of the patient's money as possible and get them the most effective thing, which is they have to get their home and environment clean. Otherwise, they're not going to get well, even though they think they might. They're not gonna. So where would you help me start?
So it really does depend on the client patient because every situation's a little bit different. Sometimes you have skeptical patients that really need that first push. Like there's no way that there's a problem in my house. My husband built it 20 years ago. He knows what he's doing. There's no way there's mold in my house, right?
Let's just
And
have that
and
today. I swear to it.
yeah, and so that might be something that person needs. Oh, I don't know if you lost me. Oh, there I am.
No, I'm there. I'm there.
Okay, that might be something that particular person needs just to get them over the edge, just to realize that they have a problem. To break through that denial of my house is a problem. Where it gets a little bit trickier, though, is sometimes the test can, especially when you're self-performing the test, sometimes it can have limitations. And what we've found is for an accurate dust sample, you really want somewhere between 500 and 1,000 square foot for that sample. So if somebody has a 3,000 square foot house and they're doing one dust sample, that's not going to be an entirely accurate sample. Also, when people are collecting it themselves, sometimes they either skimp on the dust, they just wipe a bunch of clean surfaces and say, we weren't able to find any dust, or they'll do the opposite and go on the top of their refrigerator where it hasn't been cleaned in years and just overload the sample with dust. So I think that there is a balance between a professional assessment and a do-it-yourself assessment. And so for the people that are going to do a self-screening just as a first step, it's a lot of times it can be good information, but I don't think it's going to be necessarily the best information. And so they may end up having to do some additional sampling once they have a professional assessment done. Like I said, for example, if you have a 3,000 or 4,000 square foot home and you've just done one sample, a lot of times I've seen people that maybe don't do the whole house. They just do their master bedroom and their living room because that's where they spend the time. Or, maybe they'll do the whole house, but it won't, it'll just be ambiguous in terms of what the results mean. So sometimes, you may have to do some additional follow-up sampling, which obviously, is a budgetary consideration. So, I usually like to talk to people first, just to see what's best for their situation. Like I said, if they need that push to get them to the next step and what it takes is just doing an initial home screen for themselves, then I support that. But if you're convinced because of their blood work and they're convinced because of their health and they're open to just initially going for an assessment, I really think that that's the best step because that's where you're going to find the problems anyway. If you do the test, if you do the dust test, more than likely it's going to come back with something, and you're just going to end up postponing the inevitable of having that assessment anyway. And so at that point, you kind of spent $600 just to postpone the inevitable. So I think a lot of times you can start with an assessment, and then if the assessment doesn't show the problem, then you can do sampling to either verify that the house is clean or to get more information on where you have to start looking deeper.
I mean, ideally, in a perfect world, I just call you in, you come in, I don't have to fight with anybody. But that's not the real world. The real world is they've got a conglomeration of symptoms, and some people think they have mold, some people think they have totally something else. Okay. So I do screening tests. I don't do every CIRS marker, but let's say 5 out of the 10 or so. And there's something that's not quite right there. And this person's got a multitude of complaints that could be CIRS or could be something else. So for me, having a test that's reasonable to do, that covers a lot of things, to get a positive and then get them to you is my goal. Now, in a perfect world, I'd have you walk in everybody's house that I think, hey, I want an assessment, but that's the 1,500 base fee plus whatever extra goes on to that versus $600, as you just said. So that's a dilemma for me. Because I want to get them there as fast as possible. And I want them to get in there with somebody who knows what they're doing and not get a rerun like happens all the time as they go get their neighbor to do a test, or Johnny Mold down the street.
So there's a couple air samples in the house and tell them everything's fine.
Well, it happened to my house. I mean, I can tell you, after I got my bedroom remediated, very well-known gentleman found some, air samples beforehand. So he comes back in after the 32 hours of the weekend at the big, I forget what you call the air filters, but the big filters. And so anyway, he goes in there and he says, yeah, it's fine. And I wiped the floor. He left, and the ERMI was sky high, and not, it was just like, really, so anyway, let's get into some things. So I got it. I know where you're at. And for me, you'd be a gold mine for me, because I want to get people to cut to the chase, to find out what's there, because they can't get well if they're swimming in mold, if they really have CIRS. So can you just briefly tell me and the audience what an ERMI test is, endotoxin and actinomyces, just those three, just because I use it and I want to hear your explanation of it.
Sure. So the ERMI test, that's basically, another name for that is a MSQ PCR. So it's mold specific quantitative PCR. It's basically a DNA analysis, and it's a panel of 36 different molds, and it's so you collect the dust, and the dust gets extracted from the cloth, and it gets analyzed for 36 different molds by DNA. And so the result that you'll get will be a list of all the different molds and how much you have. Some will be non-detect, some will be in the thousands, some will be 65. So based on those results, that's the information that we can use to see how moldy the home is. Where it gets a little bit trickier is the ERMI itself, ERMI. That's basically a trademark that was developed by the EPA, and part of that test and part of that development was to provide a score. So there's an algorithm that goes to the testing, and at the end of it, you get a score anywhere from -5 to 20, 30. And based on that score, it's supposed to tell you the moldiness of the home. Now, they've done some research, and even the EPA itself has said, that score isn't really perfect. There is some data to support that the higher the score, the moldier the home. But really, the value in that analysis is the actual data that you get from the DNA. So basically, seeing which species you have that are in the home and what levels they're at, that's going to be much more valuable than the actual score itself. Because we've seen some scores that are very low that still indicate high levels of a concerning mold. And then we've seen some scores that are very high that are only high because of maybe an error in the algorithm, or some molds that are high but very naturally occurring. So we tend to not base analysis just on the ERMI score itself, but the data that you get from doing that test is very valuable. So
are the results on an ERMI, are you compared to other households across the United States, or is it a comparison or just a measurement? In other words, is the quantification compared to other residences,
Yeah,
or
so the the ERMI is actually Environmental Relative Moldiness Index. That's where the ERMI comes from. So it is a relative term. So they basically did 1,000 homes and they put a scale together and they said, here's your average. And then if you're above average, the higher the score, below average is the lower the score. And so, yeah, that is a relative index. Now, the data that we have from those tests, um, you can't always get down to zero, right? There's so much mold that's just naturally occurring. We're not trying to do an ERMI, and we don't want to see zeros everywhere. We're expecting that you're going to see a lot of cladosporiums, different types of Aspergillus and penicillium that are naturally occurring, and so the goal isn't zero. The goal is what's within a normal standard, and also which of these molds are toxigenic, and we want to have those toxigenic molds be at a very low level. But yeah, there is the interpretation of that data does rely on some relative comparison.
okay? So with the ERMI test, you're measuring live and dead mold, correct?
Yes, and that is one of the limitations of the ERMI test, is since it's testing for the DNA of mold. It's like a crime scene. You can have DNA that they've tested from the 1970s and they're able to find the killer, because of this DNA that they have, right? So DNA is DNA. It can be from a roof leak that you had 10 years ago and you replaced the roof 5 years ago, and it doesn't mean your roof is still leaking, but that mold is still there. Or you could have an ongoing problem. So that is one of the limitations of the ERMI test, is that you're not going to get that sense of, is this an active problem? Is this a big problem, a small problem, an old problem, a new problem? So the ERMI test is just one of the tools that we use for mold testing. We also do another analysis. So the part of the professional assessment, if you did have me collect the sample, I actually sample for viable mold as well as just the ERMI. So basically, what that is they take the dust, they extract it, they analyze it through the panel for the ERMI panel of the DNA of the 36 different molds, and then they take part of that dust and we send it to a different lab, and they grow it on culture plates to see what's actually going on in the home with viability. So that helps us to see not only what's actively growing in the home, but we can see what are the molds beyond just the panel of 36, because there's hundreds of thousands of different mold species. There's over 200,000 molds that have been identified, and the DNA, the ERMI panel is only running through the DNA from 36 of those molds. So by culturing it, we're able to see a lot of different molds that aren't on that ERMI panel.
Tell me about endotoxin. I was assuming that it is an organism that's found around more like plumbing or that part of the house. Is that correct?
Yeah. So endotoxin is a bacteria that's mostly associated with fecal matter. So a lot of sewer gases, sewage leaks, livestock. Sometimes those are things that produce endotoxins. And so like I said, if you've had a sewer backup in your home and it wasn't cleaned up properly, you can have an unhealthy level of endotoxins. Or if you have a sewer gas leak, so sometimes you can have a cracked pipe in the wall, or I've seen a shower curtain rod that gets screwed into the wall. Right behind that, there's a pipe that's running up. It's not a pipe that carries water; it's a pipe that carries sewer gas. So you're not ever going to see a leak, right? So you're not going to see water coming through. You're never going to see any damage, but you're going to have a smell possibly, and you're going to be exposed to endotoxins. Same thing, if you live, for some farmland, or livestock raising, you may have buildup of manure, things like that. People that have a lot of dogs or animals, they may have an overload of endotoxins. So it's a bacteria that's associated mainly with fecal matter. And, there is CIRS related to endotoxin exposure. And so it is something that can be tested for.
Yeah. How about actinomyces? It's another bacteria that hangs around, I guess, water damaged buildings or.
Yeah. So that's there's a ton of different actinomycetes bacteria, actinobacteria, and that's a relatively newer test. Dr. Shoemaker has kind of been on actinobacteria development for the last couple of years, but I think that they're still defining what that sampling looks like. So I actually defer back to the doctors that are concerned about that, because there's actinobacteria that are developed from water damage, but there's also actinobacteria that are human born. So like skin infections and things like that aren't related to water damaged buildings. So we can offer the testing, but I usually defer back to the doctors to interpret those results, because it seems to have more of an impact on the health of the occupant rather than the health of the building. A lot of times where the actinobacteria are, the water damaged actinobacteria they grow in similar conditions to the mold. So typically if we can find the mold in a building, we'll also find the actinobacteria, unless it's human born, in which case I defer back to the doctor, because then that means it's a regimen of skin treatments and washing and clothes, things like that. So
how about, answer the age-old question: what's wrong with air testing? Because that's the gold standard. I've had people. Well, anyway, that's the gold standard. So tell me your 2 cents.
The standard. I wouldn't call it the gold standard, but it's the standard.
I'm being facetious.
The bronze standard. I don't know if we have time, but yeah. So basically, just I
have an angry husband who's upset. Okay, and he said, and their air testing was fine.
Sure. So yeah, there's a number of things that are limitations to air sampling. Number one, it's a snapshot in time. So basically, if you've ever seen air sampling, or if you're familiar with it, they come in and they have a pump, and they have a cartridge on a tube, and they run the air pump for about 5 minutes. And so they're collecting the air that's about the size of a beach ball within that amount of 5 minutes. And so that's one of the limitations is, you're collecting air the size of a beach ball in a room and trying to make a determination of what's going on in that room based on that limited amount of information. So beyond that, they take the air, and what's collected in the cartridge gets sent to the lab, and it gets looked at under a microscope. So there's a degree of human error, because what it takes to actually analyze that slide, depends on the skill level of the micrologist or microscopist. Sorry. So there's an amount of human error plus a just lab error in general. I was reading an article yesterday actually that says the average margin of error for a spore trap sample is from 30 to 200%, meaning you can have a 200% margin of error on a spore trap. And that's a lot. So especially when you're comparing indoor to outdoor, because that's the main thing that consultants that do spore traps and air sampling do, is they take a sample outdoor and they take some indoor, and as long as the indoor samples are less than the outdoor samples, then they say everything's okay. But if you have 10 outdoor and 10 indoor, and you have a margin of error of 200%, then that's not really apples to apples. There's still so much variability there. Beyond that, what they're only able to get it down to the genus of the mold. So basically, there's a ton of different Aspergillus and a ton of different Penicillium, species, and some of them are naturally occurring, some of them are toxigenic. But when you do a spore trap or an air sample and you look under the microscope, they group all of the aspergillus and all of the penicillium together as one group. So if you ever see an air sample report, you'll see it just says aspergillus penicillium, and then you'll get a number. The reason why they group everything together is because under the microscope, it all looks the same. So they can't determine which of these are aspergillus, which of them are penicillium, which of them are water damaged molds and highly toxigenic like aspergillus versicolor versus what might be a naturally occurring outdoor mold like penicillium brevicompactum. Those are all going to be grouped together as the same because they all look the same under the microscope. So that's the benefit of doing the DNA analysis, is you can actually get it down to the species level. And you can say, is this a toxigenic mold, or is this more of a less concerning naturally occurring mold?
So lastly, on just some of the basic assessment, like mold plates. I remember 20 years ago, we used to put mold plates around and tell people, but I mean, obviously they tell something, but it's going to miss a lot, correct?
Yeah, so you're going to just get what's floating around in the air. The limitation with the mold plate is, again, it's hard to speciate. So you're always going to have some degree of mold. So, I've had people freak out because their plates start growing something, and that just means that you're in a normal environment. Part of the limitation of that is you're only going to get viable molds. So if you do have a home that's moldy from a historic event, you're not necessarily going to see it because those molds may not be viable anymore. So that's one of the biggest limitations to the culture plates, is you're only looking for viable mold when you may have a problem that's historic. Also, you're just relying on that spore to come floating around and landing on that dish, at the time that you have it open. A lot of them are, some of them are 3 hours, some of them are 24 hours, but the mold comes out at different times. Some of it's seasonal, some of it's very temporal. Some of it's morning, some of it's evening. Some of it depends on the conditions of the home, whether you have it all closed up or open. If you have the HVAC on. So that's also one of the limitations of the air sample with the snapshot in time. So that's why we're a big proponent of dust sampling, because you get to see some historic data, the dust that's developed over a period of time, rather than just getting what's in the air within the moment that you're doing the test.
So I want to go to remediation here in a minute, but in kind of putting it together. So for me as a practitioner, I mean, I would just soon never tell somebody to do another ERMI test or what, just truthfully, and just send them to you. But you can't do it that way. Sometimes you just have to convince them slowly but surely over time. So my question is, so you have this base fee of $1,500. It may have changed, but that's what you shared with me. Now you may add testing onto that. So what is there a range that you could say? I know it's hard, but like, $1,500 to $5,000. I mean, $3,000 to get your house assessed, or $5,000. I mean, that's what I need.
When we talked, I threw out the $1,500. That's basically an average inspection cost. I've done inspections for $600. I've done inspections for $6,000. With testing. So it really just depends on what the client needs, and a big part of it is the house. How inspectable is the house? Because part of the inspection could involve lifting back carpet, possibly even taking off baseboards, looking under the toe kick cabinets, things like that, crawling through the crawl space, going through the attic, all that. It really is just based on the amount of time that I spend at the home. So if you have a home that, with all the finishes that are intact, with no visible signs of any kind of water damage on a concrete slab, I'm probably not going to be able to spend very much time in that house because there's really not a lot to see. So that'll be on the lower end of the assessment, maybe even, $500, if I'm only there for a couple hours. But I did a home recently that I had to go back 3 times because I ran out of time, because I just needed to see more and more. And, 6,000 square foot home with the crawl space, 3 different attics, So that's, that takes a lot of time to be able to see everything. So like I said, $1,500 is a pretty standard average. I'd say 1,000 to 1,500 is an average, 2,000 square foot home with a crawl space.
So would I be able to just say, just call him up and talk to him, and then he can give you a ballpark idea? Is that reasonable?
Yeah, exactly. Too? And I've done free consultation as well, where I just go to the home and meet with the client, look around, and then I can give them a better idea of what this assessment might look like. And then, yes, there is also the testing options. So, depending on the sample or depending on what the assessment shows, will determine what kind of sampling might be appropriate. I think a lot of times by the time I do a visual assessment, if I'm able to identify 4 or 5 different, fairly substantial problems in the home, there's really no need to do the testing because we already can tell what the scope of remediation is. So for testing, the benefit of testing is either just to see what is kind of to gauge what is your exposure level, right? In terms of, people that need to know, should I move out immediately? How much at risk is my health from being in the home? That's a good reason to do testing, or to determine how contaminated are all my belongings, right? Because that's part of the remediation is, do I need to get rid of my mattresses? Do I need to get rid of my couch? Do I need to, deep clean everything? So that's one of the reasons for doing testing. But in terms of just being able to identify the problems and come up with the scope of remediation, testing isn't always necessary for that.
Okay, so let's talk about remediation, medical remediation. Tell me what that is and what makes you special versus somebody else just, a good contractor seeing mold and cutting it out and fixing it. And how do you document that it's done correctly, I guess, is another question. So remediation.
Yeah, sure. So the difference between traditional remediation and medically important remediation is that I think that medically important remediation has been guided with physicians' input, basically. So traditional remediation, which was kind of developed, like I said, back in the 90s, 2000s, is when it really ramped up to say this is what the standard is, and that's where they, in the standard it talks about removing moldy drywall and cleaning to a certain degree, and then doing clearance. It provides the guidelines for a basic remediation job, and that's kind of what the industry tends to follow when you talk about franchise companies and insurance companies, vendors, things like that. Basically, they're going off of the guidelines that were developed by the insurance companies and contractors to say this is what it takes to get rid of mold from a structural perspective. Where the next step to that would be the medically important, and that's where you also consider what does it take to get rid of the mold to the occupant safety perspective. Right, so it might not be good enough just to cut out the sheetrock. You actually have to do more thorough cleaning in order to get rid of the mold.
So how would you know what level to go to? Because I don't know, you can't look inside the patient at that moment. So you're already going to a certain level because you do it differently?
Yeah, so it's just a higher standard of cleaning and thoroughness. That's the bottom line. Plus, there's also a chemical aspect. I think traditional remediation, they still use chemicals. So basically, medically important remediation, we don't use any chemicals beyond just regular soap and water, unscented dish soap and water. The key is removal. I think that if you talk, you hear a lot of horror stories about the failures of remediation, and I think that I could guarantee that anybody that has a horror story, you'll find that their contractor used a chemical. They sprayed it with something, they encapsulated it, they sealed it, they did something that was chemical based rather than not. So basically, our focus is just on manual physical cleaning and detailed removal and thoroughness. So it's basically just knowing how much material to get rid of, basically getting beyond the extent of where the damage is, and then thoroughly cleaning the environment. Those and not relying on any kind of chemical treatment. I think those are the kind of the cornerstones of medically important remediation.
So that would be a something for somebody to ask somebody if they were just somebody came over and was going to do some remediation. You'd say, oh, what kind of chemicals do you use? I mean, I mean, just they could say in a nonchalant way, and if the guy says, yeah, we use all kinds.
Yeah,
I
I mean
mean,
I've had to do that because I had to vet. I had a client that was buying a home in Utah, and so I couldn't do the remediation, but I offered to just help him out to try to vet somebody for him. So I called all the local remediation companies, and I just did exactly that. Can you tell me your remediation process? What do you guys do? And basically, all of them said, we spray this. And I said, oh, well, do you guys do any sanding or cleaning? And said, oh no, that was 5 years ago we stopped doing that. Now they have this great chemical that you can just spray on everything.
So does that make it? And so the reason that they might not do that is it takes more labor. So your efforts are more labor intensive if you're cleaning with soap and water than versus spraying a chemical. Is that kind of the rationale, or why did they switch over? You know what I mean? Or
it's easy and fast, and I think just intuitively you just think, okay, if I have mold, I have to spray something on it to kill it, right? I think that's just intuitive. And without you have to just really dig into the science to realize that that's not the solution. The killing the mold isn't the key, because dead mold is still going to contain all the allergens and inflammatory agents and toxins that are in the live mold. So killing it doesn't get rid of the problem. You have to remove it. And so anybody that's chemically based, all they're doing is trying to kill the mold, and a lot of times it could already be dead. So that's the reason why that doesn't work. In terms of why people do it, I think that's just misinformation out there, and part of it's intuitive, part of it is just this is what everybody else does, and this is the easiest thing to do, and it's apples to apples with the franchise down the way.
so is there? That's actually very enlightening to me now that I think about it. I never thought about asking about chemicals versus just cleaning. Is there any other pearls that you can tell a homeowner or somebody to ask someone who's going to remediate their home, as to kind of get a red flag if there's something, or a positive flag, but that this person knows what they're talking about, or a red flag besides using soap and water and cleaning?
Um, so I think it's very, very difficult to find a remediator that is familiar with medically important standards. Even just when they say that they're by the book, there is an industry standard called the IICRC. They published a book, and pretty much all of the insurance vendors and most places that you look at that are within this industry, most restoration companies, they're all IICRC certified, and the IICRC has published a standard on how to do mold remediation, and most of them say they follow that standard. So that would be one place to start. But I think that what I've seen is a lot of companies that even say that they follow the standard, they don't actually, because in that standard it actually says don't apply chemicals. But it's one of those things that gets overlooked. I think one of the bigger things is non-toxic. A lot of people say we use non-toxic chemicals, and so that makes people feel a lot better, right? Like we're everything that we spray is all natural. It's just from thyme seed oil extract and essential oils and hydrogen peroxide or vinegar, and all that, those types of things. But it's really all the same. It's just a crutch. and there's really no substitute for just detailed cleaning.
So tell me how. So you've come over. You found we sent someone to you. You came over and you told them the testing. You found out that did the testing. You found out how to remediate. Um, when do you do follow-up testing? So you get done with the remediation. Do you do it right away, or do you wait a month down the line so they can turn on all their ACs and let everything run around and see what's left? What's the correct thing to do?
And so it's usually twofold. So number one, you would want an evaluation immediately upon the completion of the remediation. And I don't do that for our projects. I insist on that being a third party because I do believe that there could be a conflict of interest in that regard, in terms of me just saying that the work that me and my crew did is good enough. No, we did the best job. You don't have to worry, right? And I don't feel comfortable doing that. It's one thing to just be able to go into a home and look and say, oh yeah, look, I went in your crawl space and it's all moldy, and here's pictures of the mold that's growing on the framing, right? And here's how to clean it up, right? That's not so much a conflict because you have documentation, you can have that verified if there's a concern. But after it's cleaned up, to say, okay, look, we cleaned it up well enough, that should be done by a third party in all regards. So I think that's where the potential.
All right. So the problem that I see with that is, I mean, how do I pick a third party if most people don't know if they're not coming from a medically supervised point of view or medically assessment and remediation point of view?
Yeah.
So let's say I repeated the panel number 8 for ERMI, endotoxin, and actinomyces. Would I assume it would be less?
Yeah, definitely it should be. I mean, hopefully it would be within an acceptable range. And sometimes it isn't because there could be other hidden sources. And so that is the benefit. So what I was saying, though, is that immediately after the remediation, you do want some type of verification of the work being done sufficiently. And I think to answer your question, or to go to your point about, well, nobody that's, if you can't find a medically important assessor to do that, then you're at a disadvantage. But I think for me, the way that I see that is, for a quality control, for an independent quality control verification, the standard, as long as you find somebody reputable that's paying attention, that has good testing methodology, that should be sufficient. You're not relying on somebody. It's not the same skill set as being able to go into a home and find all the mold. To go into a room that's been remediated, look around and say, yes, this remediation was done properly, and here are some samples and data to show that. I think that's a little bit of a different standard than to go into a house and try to identify all the problem areas of the mold.
So then let me ask you this. If I said, okay, give me a list of some people, third parties, could you do that?
Yes.
Yeah, I mean, because that would be one thing that I would want, because obviously, I'll learn real quick. I mean, if I refer to people, I'm thinking this selfishly and as an educational thing, okay? Because I've been doing this a while, and you go round and round and round with the assessment and etc. So, all right, I think I got some pearls. Is there anything? I mean, I've got a lot of pearls, but
well, let's. So to answer the rest of your question, though, so that's an immediate verification that the remediation that was done properly. So that's, for example, we find water damage in a kitchen or a bathroom or a crawl space. That's just immediately inspecting those areas to make sure that known mold was taken care of. Now, what you're also referring to is, 4 to 6 weeks later, gauging the health of the home beyond that. And the reason why that's important is just because we don't know. There may be other hidden issues. There may be other hidden factors that weren't addressed during the remediation, or there may just be a cleanliness issue. Maybe the work area was done fine, but the rest of the home wasn't cleaned to the same degree. So that's where that follow-up testing would be valuable, and that's 4 to 6 later after new dust has a chance to develop.
And what keeps you doing this? What
That's
drives you to
easy.
do this?
That's actually pretty simple. It's helping people, really. Seeing the difference that we make. Being able to talk to somebody and know that they're sick, and doing what we can do to make their home healthy. And I've had plenty of success stories that just that's the easiest part. That's what keeps it interesting. What keeps it interesting is that every project's different. Nothing's the same. No house is ever the same. No client's ever the same. I'm still learning things even after doing it for over 23 years. I'm still seeing new things that I didn't know, and being able to learn new skills and new information. The technology keeps getting better, the science. But then, just being able to help, having a patient that's sick and giving them hope that they can be back in their home and hopefully not be sick anymore.
So I have another question. So some people that are assessors, let's say at the conferences that I've gone to, and I know you've been to, they'll do something across the country, like they'll have somebody walk around with their computer laptop and show pictures or something like that. So do you just work locally? And I mean, I didn't even know you were you're like 15 minutes from my office, which is like a dream. But I do you go up in the foothills? Do you go to the surrounding areas? And I'm asking you two questions. One, what's your range? And two, is when somebody's really far away, can you do an assessment via some kind of electronic means?
I don't do that personally. There are some very good virtual assessors out there that I would refer,
Mhm.
but I don't. I'm not skilled in that, so I'm still a physical. Yeah, I physically
Right.
want to be involved in the project. In terms of my area, it's wherever the client need is. So yes, I travel. So I am located central to Sacramento, but I have clients in Nevada, pretty much most of Northern California. I have gone to Southern California for the if needed. So I am willing to travel.
Okay. So foothills isn't too far for you.
Not at all.
That's great. Anything else you want to say? This has been great. It's great for me. Selfishly, is like I can't practice it unless I can't do this medicine well, no matter how hard I try, unless I have a relationship with somebody who can assess the home or the residence. It doesn't work. You end up running into a brick wall, and everybody gets frustrated. Truthfully, patients
Yep.
frustrated, families frustrated, you're frustrated. They're sick, and you can't. So um, tell us about how we get a hold of you, and anything else I didn't cover that you would like to share.
I think that was pretty comprehensive. Maybe this could just be an introduction, and we could dig into some of these topics some other time if you'd be interested, because there is a lot of information. This was pretty surface level to try to cover it all. So I'd be happy to expand on any of these topics, or if anybody does want to reach out and has questions about anything that I've said, I'd be happy to discuss further. Um, just know that unfortunately, mold remediation isn't all created equal, and it is very difficult to find a contractor that can remediate to the standard that you need to have it be a clean and healthy space. So just be aware of that. There's a plenty of people that say that they do mold remediation, but just not necessarily at the standard that mold remediation needs to be done.
We got it.
So I'd be happy to help and walk you through that, and offer consulting as well as assessment and remediation.
So how do people get a hold of you? Phone number,
Um,
website?
yeah, so my website is jwinviro.com. Phone number is 916-540-8595. And between those two things, you'll be able to get a hold of us.
I'll write a summary and it'll be underneath this, and this gets posted on 4 or 5 different platforms. So, James, it's been a pleasure. You're really, I'm really, really glad I got to meet you. I've done virtually the CIRS conferences the last 2 years virtually because I just couldn't get out there. And what happens is you sometimes